When you're first diagnosed with cancer, obviously it's extremely overwhelming, and there's a lot of moving parts to try to put together, as you plan for your treatment and your care. I think it's extremely important to make sure fertility is discussed very, very early in the course of care and before you have started any kind of chemotherapy or radiation. Once the therapy has started, it can be much more difficult to discuss fertility, particularly once eggs and sperm have been exposed to chemotherapy. The best time to discuss fertility is before the therapy has started.
Depending on the amount of time that you have available before your treatment starts, and depending on your age and what your treatment will consist of, ideally it would be great to talk to a reproductive endocrinologist beforehand. Oftentimes you don't have that luxury, depending on the urgency of how your treatment needs to get started. And oftentimes some of the interventions can't be done in such a short period of time. But it's important, if possible, to have a discussion with a reproductive endocrinologist so you can make the decision about what you want to do or what you want to take time to do before your treatment.
For women, the younger the woman is, the more likely she's going to have no problems. The older she gets, the more likely she will have problems, and that's a really important nuance.
In general terms, I would say that preserving fertility in women, the options include storing eggs or storing ovaries. They can peel part of the cortex of the ovary and store that. The challenge is the timing, and so you have to be very careful in terms of knowing for your specific case whether or not preserving fertility is an option through one of the established ways that they have, whether it's preserving eggs or preserving ovarian cortex, and also the time that's involved. Deferring chemotherapy or treatment for the cancer is usually not advised, but again, this is something that's very personal and really requires a conversation between you as the patient, your oncologist, and a fertility specialist. There are some ways in some patients, and perhaps in many patients, where you can preserve fertility by speaking about this ahead of time. For men, this can be simply sperm banking, but there are also some more involved ways that men can have their fertility preserved by either having testicular biopsies or cores that are stored for future use.
There are other options if you can't have children naturally. There are ways you can have a surrogate, carry the pregnancy to term if your eggs have been frozen away or if you have a fertilized embryo that's been frozen away. And the other thing you have to remember is in this whole field of reproduction that there are so many new techniques that are coming out. So what is available now wasn't available 10 years ago. So there will be progress in this area. Obviously, adoption is a very likely possibility, but it doesn't mean that you're not sad or you don't mourn the fact that you can't have a child yourself. But that's not the end to prevent you from being a parent. There are other options that will work.
I think it's important for you, for all young people to understand, if cancer is the diagnosis, that not only is there an outstanding opportunity for you to be cured today, live a normal life, but there's an outstanding opportunity for you to continue to be able to have a normal life, and it includes having children.